they are any oil, olive oil, corn oil, soybean oil, safflower oil, sunflower oil, coconut oil, palm oil, oil in a cracker, oil in a piece of bread, oil in a salad dressing. Oil injures endothelial cells, as does anything with a mother or a face, meat, fish, chicken, fowl, turkey, eggs, and anything that is dairy, milk, cream, butter, cheese, ice cream, and yogurt, and sugar, and I don't like coffee with caffeine. And does that do it? I guess it does. There, no oil. Olive, soybean, and palm oil intake have a similar acute detrimental effect over the endothelial function in healthy young subjects. There are multiple studies confirming this. Now, here's a new wrinkle, because I'm thinking now of my wonderful friends who ate dinner with us last night at the Hyde Park Steakhouse, who our wonderful host here at this conference was able to persuade to make several vegetarian meals. However, there were a number who were eating fish and beef and oil. But let's just look at why that might be a problem. This is research by Stan Hazen and his colleagues out at the Cleveland Clinic. They looked at the molecules of lecithin and carnitine, which are found in animal products that you see listed here. The problem is that when you are an omnivore, you ingest these foods, you have bacteria in your gut which will metabolize lecithin and carnitine into TMA, trimethylamine, which is rapidly oxidized by your liver to trimethylamine oxide, which injures your liver. Here's the scheme. Lecithin and carnitine, gut bacteria, if you're an omnivore, TMAO, vascular disease. Plant-based diets, on the other hand, when Stan Hazen took somebody who was totally plant-based, fed them a lamb chop, measured their blood for TMAO, barely detectable or not there. Why? Plant-based persons do not possess the bacteria in their gut to make TMAO. It's a great argument if you're getting into a discussion with somebody who happens to be paleo. And further, TMAO injures reverse cholesterol transport, increases cholesterol in the arterial wall. And when they looked at 4,000 patients who left their serum at the clinic, they found that those that had the highest levels of TMAO had the greatest number of cardiac events. And for people who always like to say fish are safe, fish yields the highest levels of TMAO. Okay. And now there is a molecule, dimethylbutanol, which inhibits TMA production, and you will find that's found in vinegars and in red wine, and we'll talk about that when it comes to treatment. Now, here's an interesting new study that came out in the New England Journal about 4 weeks ago. Canakinumab, which is Ilaris is the brand name. Really, it's a drug for juvenile arthritis. And when they utilized this in a prospective study, there was one dose of canakinumab which actually was able to reduce cardiac events in this large trial. Now, the benefits were canceled because it is such a brutal drug for your immune system that the deaths from infection canceled out the benefits. But the point was this: all the benefits that were seen with this drug, it didn't budge the LDL cholesterol at all, which really fits right into this whole thesis we're talking about this morning, namely, and that Dr. Wood, I think, so elegantly described. Nothing is as anti-inflammatory as whole food plant-based nutrition. But why do you have to decrease the inflammation with a drug that's going to kill you from having an infection? Doesn't make sense. I don't get it. So, what are you going to include? You're going to have all these marvelous whole grains for your cereal, bread, pasta, and rolls, 101 different types of legumes and lentils, all these marvelous red, yellow, and green leafy vegetables, white potatoes, sweet potatoes, and some fruit. Now, I should share with you that Once a month at the Cleveland Clinic Wellness Institute, I do conduct an intensive 5.5-hour seminar for patients with cardiovascular disease. And with what I've just shared with you of the importance of the endothelial cell and nitric oxide, since 85% of these people come from outside the state of Ohio, and they're self-referred, I only get one crack at them. So I can't stand failure. And I like them to comply, to be adherent. So how do you get the message across? Well, we'll talk about that a little bit, but one of the ways is after I've finished my spiel on the endothelial cell, I'll say to a patient, or any patient that I'm talking to, how often do you eat out? Oh, not much. Let me try that again. How often do you eat out? 3 times a week. Okay. That's all right. That's 156 days out of 365. And even though you've already trashed your endothelial cells, you had a heart attack, your endothelial system is now a train wreck. That's 156 days that you are still further destroying your endothelial cells. What? I didn't think of it that way. Well, there are 4 reasons to go out to eat, right? 1, you don't do the cooking. 2, you don't do the dishes. 3, the ambiance. 4, the companionship. You never go out to eat to further destroy your endothelial cells. So I asked these patients, this is something we started, it's not in my book, just in the last 6.5, 7 years. I see a patient who's had a heart attack, and that endothelial system is a train wreck. I asked them to imagine they're getting their head inside their artery to their heart, this disease. You will see an absolute oxidative cauldron of inflammation. So I need antioxidants. No, don't go down to the health food store and buy a jug of pills that says antioxidant. It won't work, and it's going to be probably harmful. You're going to get your antioxidants from food. What food? Food that is high in what we call ORAC value, O-R-A-C, oxygen radical absorptive capacity, rolls right off your tongue. And what are they? If you're having raspberries, blueberries, strawberries, blackberries on your oat cereal, it's a great start, but nothing can trump the antioxidant value of green leafy vegetables. So I need those patients to chew a green leafy vegetable 6 times a day, roughly the size of their fist, after it has been first boiled in water 5.5 to 6 minutes so it's nice and tender. Then they must anoint it with several drops of a delightful balsamic vinegar. Why? Because the balsamic vinegar has acetic acid, which has been shown to restore the nitric oxide synthase enzyme contained within the endothelial cell responsible for making nitric oxide. So I want them to chew this alongside their breakfast cereal, again as a mid-morning snack, again with their lunch and sandwich. That's 3, mid-afternoon 4, dinner time 5. God, I adore it when they have that evening snack of kale, 6. What are they doing? All day long you are basking and you're bathing that horrible oxidative cauldron of inflammation with nature's most powerful antioxidants, right? Pretty exciting stuff. What are the green leafy vegetables I'm talking about? They are bok choy, Swiss chard, kale, collards, collard green, beet greens, mustard green, turnip greens, snapper, cabbage, Brussels sprout, broccoli, cauliflower, cilantro, parsley, spinach, and arugula and asparagus. Now, the top 6 would be kale, Swiss chard, spinach, arugula, beet greens, and beets. No oil! All right, I want these